Medical marijuana. Cannabis had originated in Central Asia, where it was there used commonly as an herbal medicine. The Chinese, however, used hemp from cannabis for its textile properties. Hemp from cannabis was very good for producing products such as rope and paper. And there is little record of ancient civilization using cannabis for the purpose of getting high. For trade, cannabis had made its way all around the world, and it became a part of many cultures. One of these cultures including Mexican. And shortly after the Mexican Revolution, there was an influx of immigrants into the United States. And since weed had been considered a part of Mexican culture when it was brought into the States, U.S. officials had used that to their advantage in deporting and detaining Mexicans. What they did was they banned marijuana, and when they found it on a Mexican or an immigrant, they then were easily able to detain or deport them. During the 1930s, there had actually been claims that cannabis had been causing black men to assault white women. And during this age in time, that had initially brought forth the Marijuana Tax Act of 1937. This initially banned the use and sales of cannabis, and shortly after that, it had actually been ruled unconstitutional. Although the use of marijuana had just been ruled unconstitutional after an act had been put into place to limit the use of it, the Controlled Substances Act of 1970 was put into place. This was because around the 70s, marijuana usage had become extremely popular, but for the use of its psychoactive abilities in getting people high. And this had become a concern to society. So cannabis contains a chemical called THC, and THC actually stands for tetrahydrocannabinol. Now, tetrahydrocannabinol is a cannabinoid, and cannabinoids are the chemicals that initially take effect on the mental and physical abilities of one's body after consumption of the drug. So basically, this is what gives it the psychoactive effects. Now, it's known that consumption of cannabis can cause different side effects for different people. Some of those are commonly known as metacognition, relaxation, increased euphoria, paranoia, anxiety, among many others. Metacognition is the act of thinking about thinking. And this is just one example of how it takes effect on one's mental and physical state. I believe medical marijuana can be a very useful and beneficial practice in the medical field. It can help patients with pain anywhere from mild to chronic. And there's actually 3 different pains I'd like to talk about real quick. So pain travels to the brain in 3 different ways, causing 3 different types of pain signals. The first one is referred to as somatic pain, and in short, this pain travels through the peripheral nerves, causing a dull and aching pain. Visceral pain is the second type. This pain is caused by the stretching of tissues or organs, causing another kind of pain called referred pain. And referred pain is just when it feels like the pain is coming from a location other than where it's actually originating from. The third is neuropathic pain, and this pain occurs when the nerves sustain damage. Now, this is important because studies have shown that cannabinoids block peripheral nerve pain. It would be very helpful for patients suffering from conditions such as multiple sclerosis. Although many people are still against the use of medical marijuana for reasons such as thinking that it may be addictive or harmful to one's body, it is much safer than the use of opioids, which are commonly used in medical practices today for many, many diseases. For one, marijuana would be much less addictive. It has zero potential for overdose in comparison to opioids. It could also help those suffering with Parkinson's disease or fibromyalgia, endometriosis, many more. And it can even treat glaucoma patients, manage nausea. It's really good for those with cancer patients who don't have an appetite and they're losing weight. Very beneficial to those kind of patients. I think it's important that medical marijuana is brought into consideration for even those who may suffer by taking simple over-the-counter drugs such as Tylenol or ibuprofen. I suggest that they would benefit from this because those drugs contain acetaminophen, and acetaminophen can actually, well, first of all, it's an active ingredient in these drugs that can lead to kidney damage or ulcers, GERD, and it has an even greater risk of leading to liver damage such as cirrhosis. I highly recommend that physicians consider this as a form of medicine as an alternative to traditional drugs, as it really benefits patients with problems big to small.